Good afternoon. We will start the series of lectures about the clinical nutrition of dog and cat. I suppose that you are familiar with the digestive physiology of the healthy dog and cat, and also with the feeding and nutrition of the healthy dog and cat. What is the clinical nutrition? You will see, of course, beside the lecture, we have a background material to help you. This is the Veterinary Nutrition and Dietetics, edited by me. And please use the chapter 21, Feeding and Clinical Dietetics of Dog and Cat, page 529, 670. This is essential background material, and at the same time it contains not only the clinical dietetics but also the healthy dog and cat. And here you see we have to introduce this notion that therapeutic animals. What does it mean? Because this is a big help to the veterinary profession. Yes, it is clear according to the statistics that people who has a dog or a cat will have a longer lifespan and may have a very fast recovery after some diseases. Our study plan, or in other words, the fields of clinical nutrition, are the following, and our lectures will follow this logic. Number one, the feed is the vector or carrier of some harmful thing, microbe, toxin, etc., getting into the animal. The second are the nutritional diseases, when the feed or the feedstuffs are not totally healthy. They had some problem, a deficiency or imbalance. Number three is the dietary management of clinical diseases. It means that dog or cat has a special clinical state, for example, diabetes. And the dietary management is necessary for the healing and recovery. So in this case, we speak about the dietary management. And number four, we have special circumstances which are not diseases, but the diet is special. So the average healthy dog and cat food is not enough, for example, for the elderly or the hardworking dog and cat. Starting with the first field, when the feed itself is a vector or carrier of an infectious disease or noxious compound. It means it is very important to combine with the legal regulations, because meat and bone meal are allowed to use in the dog and cat food, not unlike to the production animals. But of course it should be heat treated 133 degrees under 2 atmosphere pressure and maximum 2 centimeter particle size. Why? It is to avoid the prion diseases, which is detected until now in Felidae and not in Canidae, but as a vector we have to prevent the spread of the prions. The salmonellosis can survive in raw meat and liver and kidney and other byproduct of the slaughterhouse. The barf may carry a great danger concerning the spreading of the salmonella species, and many times we can find in the literature the so-called recalls when salmonella has been found in prepared barf food, and the producer had to recall it. From the virus diseases, the transmissible gastroenteritis of the piglet, of the swine, can be transmitted to dog and may cause a severe diarrhea. What is the case with the Auyski disease? Pigs are able to carry the virus of the Auyski disease without clinical symptoms. Therefore, it is an obligation to heat treat the pig meat before feeding. So it is not allowed to feed dog and cat using raw pig meat. About the prion diseases, I have told you some words concerning the meat and bone meal. And the last noxious compound in dog and cat food may be the toxins. Any toxin may occur. The mycotoxins, the secondary metabolic product of the molds, are also may also be very dangerous. And last but not least, the coccidiostats. If you imagine a big feed plant, feed producing plant, feed mill, it is sometimes the case that previously poultry feed was made, and secondary contamination with the coccidiostats of the poultry, like the narasin, may cause a severe empoisoning for the dog. In our study plan, we arrived to the number 2, the nutrition in the fields of the clinical nutrition, the so-called nutritional diseases. The overnutrition, one of the problems of the skeleton. In case of growing puppies, it is written especially in large breed, but in some cases even in average body weight can occur. The name of the skeletal disease related to the overnutrition is the osteochondrosis. And in the next slide you will see the pictures about it, but beforehand you have to emphasize that the prevention is very simple. You have to make a rationing. It means that every time no more than 85–90% of the real requirement in energy and protein should be given. It means that a little bit the growth rate of the dog will slow down, but it's no problem. Instead of 20 months, will achieve the mature weight 22 months, for example. You have to heard about the hypertrophic and hyperplastic obesity and the cellularity hypothesis or statement. It means that the number of fat cells increases only during a specific stage of life. It means that during the late fetal development and during the growth phase. It means that in this case the over nutrition of the gestant beaches is also dangerous, and also the overnutrition during the raising up the puppies is also dangerous. Why? Because during this overnutrition, the soft tissues like the muscle and the fat tissue can grow, and the body weight will be larger than necessary, and the bones and the cartilage is not strong enough to maintain the body weight. And the results can be seen on this slides. This is the osteochondrosis syndrome, the so-called X-legs, you can see really, and the full sole or bare sole in this dog. And the X-ray picture shows us the osteochondrosis of the joint and the problem of the bone and cartilage development. This is also a overnutrition, but overnutrition of the adult animals and not of the growing animals. As a other extreme of the overnutrition is the starvation, the lack of feed, protein, energy, malnutrition. Fortunately, this is not typical in the clinical practice, with the exception of one clinical case, which will be treated during the last unit of this series of lectures, namely the starvation of the tumor patient. But returning to the obesity occurs where there is an excess intake of energy over expenditure factor. Should have been a balance between intake and output in energy, and for the imbalance, the inadequate satiety signals by genetic problems of the leptin production or leptin receptors, or the neuropeptide Y in the hypothalamus, and the uncoupling protein 1, 2, and 3 in the brown and white fat tissue, which are uncoupling the energy production before the ATP and fat production, and will produce heat. This is working against the obesity too. And the level of T3, 3-iodothyronine, and the T4, the thyroxine, the thyroid hormones. The thyroid hormones will set the intensity of the basal metabolism, and even a slight hypothyroidism may cause obesity or obesity-like problem. We have, of course, dietary factors when we not only make a overnutrition in amount, but also, for example, in fat. the neutering will decrease the intensity of metabolism, and in this case the sensitivity will be higher for obesity. The body energy expenditure can be increased by physical activity, and similarly to the today's urban modern human population, the physical activity of the dog and cat as a companion animal is also low. So another factor of the obesity. In any age classes, it means that the aging process itself will decrease the activity of the animals, and at the same time will increase the appetite, and higher appetite, more feeding, less energy expenditure. This is typical for the elderly obesity. We have to make a difference between the physiological fatness. You can see this front page of this excellent book, Eric P. Widmeyer, Why Geese Don't Get Obese, and We Do. How evolution's strategies for survival affect our everyday lives. But this is only a scientific popular title, but the book is excellent book about the obesity and why geese don't get obese, and why the animals of the winter sleep don't get obese, because they accumulate fat for flight, for example, and after they burn it. So the energy expenditure is also high. Or the winter sleeping animals will accumulate in autumn fat reserve and will burn during the winter sleep. So this is the physiological fatness, but it's not related, not the same in the case of obesity. The obesity is also derived from genetic problems of the leptin. In a healthy dog and cat, you can see the electron microscopic picture of adipocytes. These are especially from an experimental rat, from the rat fat reserve, the epididymal fat pad. But what you have to memorize, that in a thin rat, the diameter of the fat cells, the diameter of the fat cells is short, the fat cells are small, the adipocytes, and in the fat rat and fat cat dog, the diameter and the weight of the fat cells is large. And the link is that the fat cells are producing the leptin hormone, which is a signal for the brain to stop the feed intake. But in the leptin production in a healthy animal is proportional for the measure of the fat cells. It means that higher feed intake, larger fat cells, and influence, big influence to the brain to stop the feed intake. But in some genetic failures, the leptin production or the leptin receptors are not functioning, and in this case there is a genetic background of the obesity. We have to make a differential diagnosis of the obesity. This is a whole list, and don't think that in some cases even all these factors should be taken into account. One of those is the ascites, the water accumulation in the abdominal cavity. The pregnancy, if we don't know that there was a mating or artificial insemination, neoplasma growing in the abdominal cavity, constipation, severe obstipation, diabetes mellitus, vice and versa, hyperadrenocorticalism or Cushing syndrome, acromegaly or overproduction of the growth hormone, and hypothyroidism. So you have to make a differential diagnosis. After that, we'll continue the therapy of the obesity. In the therapy of the obesity, the first is the owner compliance. It means that you have to ask the proprietor to write every day a diary what they had fed to the dog and the cat. And it's very important that only one person should feed the animal, because it's not the case that one person keep the diet and the other will give in secret some treat to the animal. So this is the owner compliance. And here comes the key of the obesity dietary therapy. This is the cyclic periodic design. It means that we have to make a balance between the fat mobilization and the fatty liver syndrome. For that, we make cycles and periods. It means that 2-3 weeks we give a maintenance requirement to the dog. 2-3 weeks only 50-60% of that. To really understand this, taken a case report of my own previous dog, a Transylvanian dog hound. He was a little bit obese. Instead 27 kilogram of live weight, he was 30. So 2-3 weeks received only 50-60% of the daily amount, maintenance amount. The maintenance for the 27 kilogram of live weight, it was approximately 400 gram from a excellent pet food. Yes, but during this period there is a fat mobilization and the danger of fatty liver syndrome. So in the period we'll continue 2-3 weeks with 100%. So instead of 50%, which is 200 gram of the 400 gram, 2-3 weeks 400 grams. And this period allows the animal to burn the released free fatty acids, and in this case to avoid the fatty liver syndrome. And this cyclic periodic design should follow until the goal, the aim body weight, is not achieved, sometimes a half year. The degree of obesity should be assessed and after set the time and the degree of shortage. We have to compare the pet's present weight with its weight of achieving the adult weight 1-2 years according to the breed. We can make also the condition scoring. For details, I ask you to see the optional subject, companion animal dietetics. which type of diet should be used during this cyclic periodic design? A so-called fortified diet. What is the fortified diet? The fortified diet means that because we have to decrease the dry matter intake, in the dry matter we have to fortify, we have to increase the concentration of valuable amino acids, protein, minerals, vitamins, and other valuable micronutrients. In this case, back to the case report of my dog, in the 200 grams dry matter, the dog will receive the sufficient vitamins, minerals, which normally was in the pet food of 400 grams. During the therapy of the obesity, we have to think about the fiber supplementation. The question mark and shows us that there are problems with it. Yes, the fiber supplementation to some extent, instead of 2-3, we give 10-13% of fiber, but no more. Especially the cats cannot tolerate too high fiber. They will reject the feed intake. And this is also a danger of liver lipidosis. Instead, we put into the fortified diet, for example, low digestible starch containing feedstuffs like sorghum, barley, buckwheat, to a certain extent maize, and these low digestible starch in the short digestive system of the dog and cat remains undigestible and will dilute the energy of the other components. We can make also vitamin A supplementation, which is an excellent nutrigenomic way, because the vitamin A will stimulate the expression of the leptin genes, and by this way decreasing the appetite. But be careful, too much is toxic. So no more than 2000 international unit per kilogram, because maybe more is toxic, especially for the cats. What about the L-carnitine supplementation? The L-carnitine is a lysine derivative, and the function is to carry the long-chain fatty acids inside the mitochondria, and in this way helping burning them up. The bodybuilders also are using L-carnitine as a fat-burning agent. We have also two medicines, two drugs, which can be used only by a veterinarian. The basic chemical structure is similar. The mitratapid and dirlotapid. The mitratapid is the generic name, and the dirlotapid, and the trademark is Yarvitan from Janssen and Slentrol from Pfizer. But the action of mode of these chemicals are to inhibit the fat metabolism of the enterocytes in the intestine. By this way, from the intestine there is a signal that I'm full and stop the feed intake. The problem is that the selectivity is not enough and sometimes it will inhibit the fat metabolism in the liver. Therefore, because the cats are very sensitive liver animals, it can be used only at the dog and not in the cat. Here you can see an extreme picture about how the high degree of obesity can be found in dog, and even in the art history you can see the Botero had made a obese cat. But it is not enough. We have an excellent tool to evaluate the body mass index in case of the cat and not in case of the dog. The body mass index of the cat is the following. We need two parameters. One should related to the fatness, another independent from the fatness. Measuring the rib cage circumference, because the rib cage, owing to the subcutaneous fat, this parameter is related to the fatness. And the other parameter, the length of the lower leg, this is from the patella to the tarsus calcaneus. This is independent. This is the length of the, and using equation you can calculate the fat percentage of the body. In case of the dog you cannot use it because of the large variation of the dog body weight from half to 90 kilogram. You cannot use one equation. Namely, you can see here an extreme case of the rubber jaw with the gingiva and deformities of the teeth and bones, etc. What is that? This is the so-called all-meat syndrome. All-meat syndrome, and why? Because there is a example for that, how they could in an expert development of all-meat syndrome. You can see here in the pre-treatment column that they were fed pasta and horse meat, pasta bread and horse meat, and in the control they used the excellent veterinary diet. The similar is in the treatment. They also used horse meat and pasta and carrot. After that they could really see how developed this all-meat syndrome. This all-meat syndrome is basically a calcium deficiency, absolute and at the same time relative to the phosphate. This is an incorrectly balanced diet, for example in the fresh meat, where the amount of calcium is so low that the ratio of calcium to phosphate is 1:20. But you have seen that they were given bread and pasta. In the cereals also only 1:9 is the ratio of calcium to phosphate. It's not enough that we have a calcium deficiency, an absolute calcium deficiency. We have an excess phosphate intake, and this excess phosphate intake produces hypocalcemia and parathyroid stimulation, because the parathormone can perceive the calcium level in the blood, and the parathormone production release is stimulated to arrow up, and this is the so-called nutritional secondary hyperparathyroidism. Why is nutritional? Because the basic is the problem with the calcium supply. Secondary, yes, because it is not a tumor, a functioning tumor in the parathyroid gland. What other type of the hyperparathyroidism can occur? We will arrive later on to the renal secondary hyperparathyroidism. What are the clinical signs of this problem, this syndrome? Lameness, because the animal has pain in bone, reluctance to walk, widespread bone pain, and by radiography or DEXA, this is the dual X-ray absorptimetry, frequently used in a human osteoporosis research and treatment, will reveal poor bone density. The treatments, above all, analgesics to prevent the pain, and the prevention by the dietary treatment is giving limestone, calcium lactate, and in last cases, because the phosphate is not good, calcium hypophosphoricum. To give a vitamin D injection in this case doesn't help. And here you can see the X-ray pictures of the mentioned calcium deficiency or all-meat syndrome and the vitamin D deficiency. You can see all-meat syndrome or the calcium deficiency caused mostly a osteoporosis-like picture and syndrome, and in case of the vitamin D deficiency, only the end part of the long bones are affected, and by that we arrived to the vitamin D deficiency, which is also related to the skeletal system, and we have first make the basics. The basics is that in a growing animals we will call it as a rickets, and in the adult animals as osteomalacia. You have to see that for the development of rickets and osteomalacia, we need a diet which is deficient both in calcium and in vitamin D. There is the pathogenesis is a failure of normal mineralization of newly formed osteoid tissue in the growth plate of the long bones, and in young animal also of the cartilaginous matrix in the epiphyseal growth plates. So this is why this is a rickets and not osteomalacia. The clinical signs begin also with lameness, but the deformities of the skeletal system will cause lordosis. In growing animals, abnormal eruption of teeth, which normally is about 6-7 months of the age, and also a deformation of the bones. The treatment is, of course, a dietary correction, both by calcium supplementation and vitamin D supplementation. Here you can see the rachitis in experimental animals, because it is not allowed to provoke a rachitis in a dog or cat, only for illustration. And you can see left control animal, and right you can see the rachitic animals. And the same in the right picture, you can see the control fully developed animal, and the dwarfism can be seen, and deformities of the legs and ribs and spinal cord, and even the bone of the tail is affected. Very, very typical for the rickets is in a series of animals, from dog, cat, up to the chicken and human, is the ricketsy rosary. You can see here a ball-like swelling of the cartilage. This is the meeting point of the rib and the rib bones, and this is like the balls of a rosary of the Buddhism or Christian prayers. Here you arrive to the zinc deficiency. Zinc deficiency is a interesting disease, because primarily in the Siberian husky and Alaskan malamute can be seen the zinc responsive dermatitis. Why? Because they were the last in the domestication, and their capacity to digest and absorb the zinc is limited compared to the other breeds. The clinical signs are a series of typical skin problems: erythema, alopecia, scaling, crusting, and in case of bacterial infection, suppuration around the mouth, chin, eyes, ears, and perineum. So predilection points were present. Thick crusts may be present over the joints. This is very similar to the parakeratosis of the calves. The treatment should be 100 mg zinc sulfate orally, BID, twice a day, or 150 mg zinc oxide, or a special zinc-enriched yeast. And here you can see the pictures of the zinc-permissive dermatitis. You can see hints of parakeratosis on the joint, on the chin, on the rim of the mouth, around the eyes, and the rim of the ears. And also you can see here the zinc-permissive dermatitis, the so-called acrodermatosis. It means that the end of the leg and the nose and the head, and this is at the same time in bull terriers lethal, because the zinc is not only necessary for the skin health, but also for the immune system, and by this way the zinc deficiency will cause a immune suppressive, immune poor state, and some secondary infection will kill the bull terriers at the age of 7 to 10 months. Thank you very much for your attention. This was the first lecture from the clinical nutrition.